Mother of three trying to banish belly fat almost died after a skinny jab, quote unquote, she bought online triggered organ failure. A mother of three has told how she nearly died after injecting herself with a, quote, skinny jab, unquote, that she bought online. Lindsay McAvoy from Edinburgh, Scotland, purchased the jabs on the internet in the hope of shedding belly fat, despite weighing just 112 pounds. After shedding around 7 pounds in just a few weeks, the mother of three ordered another batch of the injections. However, the 42-year-old beautician then suffered a severe allergic reaction, which saw her tongue swell up and her eyes burn, causing her to pass out. After being rushed to the hospital, medics informed her that she had suffered a severe allergic reaction to the injections, which can trigger organ failure. The severe allergic reaction can trigger organ failure in severe cases. She said she feels, quote, ashamed, unquote, and warned that despite seeming like a quick fix, the pens are dangerous. Okay, the first big question I have to ask is, what was she injecting? It says skinny jab. It doesn't say the drug name here.
Yeah, there's a lot of layers to this one.
Yeah.
I guess the first layer I'll take is that she got it online without a prescription.
Yeah.
We are a compounding pharmacy at our local place, so that's the last thing I want to do is bash compounding as a whole. But individual businesses, sometimes very small businesses, can make their own decisions about what they're doing with their compounding. And there's layers to this as well. But we are talking about something that she bought online without a prescription. $50, not a month, but I believe it was €50 per 2 weeks. Still very cheap to access this medication. We've even done some just initial looking into it, research into how much it would cost us to get it, just to be aware of what's out there. And that doesn't sound right either.
So whatever she was getting was not a GLP-1.
Yes. And then partially, and again, I know there's a lot here, but this was an allergic reaction. So she could have gotten it from one place, or it was made one way. She could have had an allergy to one of the inactive ingredients, something that got contaminated. So with it being a compound injectable bought online. So again, you keep lowering the bar maybe for what is accepted practice.
Yeah. Mm-hmm.
And now you throw in that it's an allergic reaction. It may have nothing to do with the actual semaglutide or the ingredient in there. It could have been one of these ancillary things that would be very hard to track in a situation.
Yeah. Okay. So we don't know what she was injecting.
Yeah. The first one we're talking about is a side effect. Now we're talking about allergic reaction. So both of them I get are broadly issues associated with, but allergic reaction, very different here.
And the headline is clearly meant to pull you in thinking that's what it is, that this is the same thing. But she bought something online without knowing what it was, without a prescription. And yeah, the $50 or €50, that we already know. I mean, this is standard. We said it's like $1,000 a month or something like that.
And yes, that's, drug company prices, but still, even just at a compounding level, it's still very expensive. That's somebody making it in incredibly high volume, selling it online. This is again where there's multiple levels of ethics, let alone legality within compounding, that she found her way into. Maybe one with a little bit of a lower bar.
Yeah, it sounds that way. Now, you said compounding pharmacy. This is something that beyond just the brand name drugs, there are compounding pharmacies out there making something like this.
So this is another, we said this episode would have some controversy in it.
Yeah, here we go.
The compounding of these products is very much controversial. The only reason that we see these being compounded at this point is because technically these commercially available medications are on the FDA shortage list. And so that leaves more or less some wiggle room for compounding pharmacies to step in and fill the gap until those products are removed from that list. So I think that's kind of, all we really have to say about it. I think to Joey's point, you just have to use an extra layer of caution when dealing with these compounding pharmacies who are just, no matter if it's this or any other sterile product, there's just a level of manufacturing, criteria that needs met.
Yeah.
So that would be step one, is just where is it coming from? And then also, obviously, there's just a general gray area of the specific form of the medication. There are certain salts that can and can't be manipulated, and there's a legality issue with that. And so I don't know. I more or less digress at this point, but it's everywhere. They're in med spas. You can get them directly. You can get them with a regular prescription. You can, get them through these, weight loss clinics, more or less. And so all we can really say is just try to use your best judgment.
Let me ask it another way. Would you buy a drug online and inject it without a prescription?
Yeah. Thank you for centering us there. Because this is again, kind of like Joey said as well, this is totally different than doing some homework, talking to a doctor at a med spa, understanding maybe the background of a given compounding pharmacy who's certified to do this.
Right.
Exactly.
This is way different.
Way out in left field.
Certainly people could do whatever they want. People do all kinds of wild stuff.
They do.
And this is a wild choice.
We would not endorse this decision.
Yeah. So I think just to again make clear, we are not saying that all the compounded products are bad or inferior or a problem.
Right.
But there's a lot of layers to making sure. Again, I would view it as stepping in with your doctor's office. Do you trust this office? It seems like a reputable office, good reviews, research that. Then can you trust that they're compounding pharmacy that they would use?
Yeah.
Because technically they're only supposed to be making it for shortage purposes, which is still occurring. It's a gray thing.
Yeah.
It's a gray area. Is every time we go to order Ozempic, is it on shortage? No. But is it often on shortage? Yes.
Yeah.
So it is, and it has a place. I mean, the FDA shortage list has great value. We've made medications, anti-seizure medications for kids because the liquid's not available at times. I mean, so this has a purpose. This is definitely, it's just one of those things. People look for the loopholes, particularly when business and money is involved, and these are so hot right now.
Yeah. It's not in our list of articles here, but I know that I think Eli Lilly just bought 3 more manufacturing facilities to continue to increase Wegovy's availability because it's so in demand and shorted.
Yeah. I mean, and even in addition to the gastroparesis lawsuits, I mean, there are lawsuits with these big drug companies starting to single out some of the bigger players in the compounding space.
Wow.
So
I didn't know that.
so I guess to wrap it up, it is a bit of a legal mess.
Yeah.
It is. So you just kind of got to, at the consumer patient level, in addition to somebody in practice they just have to be careful with this stuff.
Yeah.
And not to pick on anybody, but the other thing that sticks out in this article to me is that she weighed 112 pounds when she decided to start taking a medication to lose weight.
Right.
People come in all sorts of different body types and different sizes, but that seems highly irrational to me.
Yeah. I'm glad that you brought that up because we know where these medications were studied. We know the context in which they were studied, and not that we're trying to sound like sticklers and we have all the answers, but we know based on what we talked about that these are indicated for specific BMI cut points in addition to the presence of certain comorbidities.
Right.
And so to extrapolate the information and the safety data from those studies and put them on to a person who is within normal weight or low body weight, for goodness sake, or whatever. It's you as much as we want to be able to imply those same results or apply those results. It's you just technically can't. You have to be especially careful, and then the other aspect to that with respect to our conversation on obesity in general, we talked about the fact that there exists a behavioral component, a psychological component, and a lot of times what you're dealing with individuals, regardless of their weight, is there history, or do they have histories of eating disorders or restrictive eating, certain patterns, or presence of other, mental health comorbidities, all of these things that are have an impact on how we eat, what we choose to eat. So it's just, I know she wasn't at that cut point in BMI, so to speak, but again, it just brings about that treating this condition and understanding this condition brings so much more than just the very black and white.
Yeah, we can't, obviously we're referencing an article and it talks about an individual. We don't know the person. We haven't seen her medical records, anything like that. But I think it's probably a safe bet to say that if she walked into a doctor weighing 112 pounds and said, I want to get this drug, that they would have said, no, No, you don't
There's
need
no
that.
amount of risk worth that, let
Right.
alone.
Right.
Yeah.